Welcome to my podcast. This is Dr. Jaime Daniel. Today I want to talk to you about aortic aneurysm. But first we need to remember what is the aorta. The aorta is the largest artery in the body. It has a diameter of 2.5 centimeters. It receives oxygen-rich blood from the left ventricle of the heart and distributes it to all of the body except the lungs, which receive blood from the right ventricle. Just after the aorta leaves the heart, smaller arteries that carry blood to the head and arms branch off. The aorta then arches down with additional smaller arteries branching off along its route from the left ventricle to the lower abdomen at the top of the hip bone. At this point, the aorta divides into two iliac arteries, which supply blood to the legs. There are two main disorders in the aorta. They include aneurysms, that are bulges in the weak areas of the wall of the aorta, and dissection. This is the separation of the layers of the wall of the aorta. These disorders can be immediately fatal, but they usually take years to develop. Aneurysms also can develop in other arteries of the trunk, arms, and legs. They are called peripheral arteries, such as the arteries at the back of the knee, the popliteal arteries, and the main arteries of the thighs, femoral arteries, the arteries supplying the head, carotid arteries, the arteries supplying the brain, cerebral arteries, and the arteries supplying the heart muscles, coronary arteries. They may also develop aneurysms. When a ruptured aneurysm happens in the brain, it may cause subarachnoid hemorrhage. Now, if we focus on aneurysms, we need to know that the pressure of the blood inside the artery forces any weak areas in the artery's wall to balloon outwards. If untreated, an aneurysm may rupture, resulting in pain and internal bleeding serious enough to cause shock and sometimes death. An aneurysm can develop anywhere along the aorta. 3/4 of the aortic aneurysms develop in the part that passes through the abdomen, and the rest develop in the part that passes through the chest. In older people, aneurysms are most likely to occur in areas where arteries branch, for example, where the abdominal aorta branches into the iliac arteries, or in areas of stress, for example, in the popliteal artery. Aneurysms may be round, also called saccular, or tube-like, also called fusiform. The fusiform are the most common. The most common cause of aortic aneurysm is atherosclerosis, which weakens the wall of the aorta. The less common causes include injuries in the aorta, most often due to a motor vehicle crash, inflammatory diseases of the aorta, hereditary connective tissue disorders such as a Marfan syndrome, some infectious disease such as syphilis. In older people, almost all aneurysms occur in people with atherosclerosis. High blood pressure, which is common among older people, and cigarette smoking increase the risk of an aneurysm. In people with Marfan syndrome, an aneurysm is most likely to develop in the first part of the aorta, where it emerges from the heart, also known as the ascending aorta. When we think about complications, we need to understand that consequences depend on the size of the rupture. A large rupture may be rapidly fatal, and a small wound, sometimes termed a leak, may cause warning symptoms that allow people to seek medical care. A blood clot, often develops in the aneurysms because blood flow inside the aneurysm is sluggish. The clot may stand along the entire wall of the aneurysm. A blood clot may break loose, becoming an embolus, travel through the bloodstream and block arteries. Aneurysms in the popliteal arteries are more likely to produce emboli than aneurysms in other arteries. Occasionally, calcium is gradually deposited in the wall of the aneurysm, making it easier to see on X-rays. Now, I want to talk a little bit about aortic dissection. It occurs when the inner lining of the aorta separates, or tears, from the middle layer of the aorta, allowing blood to push between these layers, separating or dissecting the middle layer of the wall from the still intact outer layer. As a result, a new false channel forms in the wall of the aorta. More than 90% of people who have an aortic dissection experience pain, typically sudden, excruciating pain, often described as tearing or ripping. As the dissection advances further along the aorta, it can close off the points at which one or more arteries branches off from the aorta, blocking blood flow. The consequences vary depending on which artery are blocked. Well, it was everything for today. We will see in the next episode. Thank you.